Good morning, class. Today you are entering the world of healthcare, and you have made a huge decision regarding your future by deciding to take the Certified Nursing Assistant course. I look forward to our time together, and your purpose for being here is to be able to perform the skills in a knowledgeable and kind fashion and take care of our elderly residents in a nursing home. There are many, many skills that you are going to have to master. This is your skills checklist. You have a copy in your folder that's been handed out. If you take a brief look at it, you will notice the very first skill that you must master is hand washing. Hand washing is one of the most important things you will ever learn. There are many things you will learn as we progress, but hand washing is basic to all of infection control and keeping as much clean as possible. There are two separate ways to do what we call hand hygiene. One is to do it at a sink with water and soap, and another is to use what's called hand sanitizer. For the purposes of what we're doing, I'm going to start by doing a bit of lecture and chatting, and then we'll move to the sink to demonstrate the actual hand washing. To start out with, there are several reasons and times that you want to wash your hands. Before you give care to a resident, after you give care to a resident, after using the bathroom, after smoking, before you enter the clinical unit, and when you're exiting the clinical unit. Hand washing is the single most important action for preventing the spread of infection. It is also one of the important things you need to remember that will be part of your beginning steps as you do all of your skills. Washing your hands is the first thing you do, and washing your hands is the last thing you do after you've completed your care. There will be times throughout certain skills that you will need to use what's called hand sanitizer. This small bottle will be in your pocket. I expect all of you to have one of these when you report to your clinical site. The way that we use hand sanitizer is we tip the bottle into our hand, pour out a goodly amount, clip it closed, hand and palm to palm, and you continually go all around the surfaces of your top of your hand, your palm of your hand, and your fingers until the alcohol in this has completely dried. The first time you attempt to put on a pair of gloves, following putting on the hand sanitizer and not letting it dry, you will learn why you must let it dry before you ever apply gloves. These can be purchased anywhere, and I expect them to be a part of your uniform. You must also have with you a very small notebook and a pen, as well as the watch. I've removed my watch for the purposes of doing a hand washing demonstration. If you keep your watch on, you need to slide it up on your arm. I also make sure I have a watch to use in the clinical unit that I can wipe off with an alcohol wipe to help that to keep from cross-contaminating. I'm going to talk to you a little bit about the fact that you have to have a professional work ethic. You need to come into this class wanting to learn and willing to put extra time and effort in to master all of these skills. Hand washing is extremely basic. Every time you wash your hands, you get rid of the germs and bacteria that could possibly be transmitted from your hands to your home, to your patients, from one patient to another. It's important to remember how this can work for you in the home setting as well. If you have small children, remember that hand washing is wonderful for them and for you to help keeping the family healthy. Our elderly are at a very high increased risk of being able to contract illness. Therefore, we want to keep everything as clean as we possibly can. Washing your hands is important to that. One thing I want to mention about our hand sanitizer, if we have an outbreak in the facility of either norovirus, which is a gastrointestinal problem with nausea and diarrhea, or if a patient has a diagnosis of Clostridium difficile, commonly referred to as C. diff, this sanitizing will not prevent the spread of that infection. So you must always, in those two cases, wash with soap and water. Florence Nightingale was the first one to come up with this idea back in the 1800s in the Crimean War. And she personally was responsible for decreasing the infection rate in the Crimean War by incredible amounts. It had a lot to do with the friction of moving the hands around and taking the dirt off that way as well. This hand sanitizer is only to be used when there is not visible soil on your hands. Okay, we're going to go over the steps of hand washing, which I have outlined on this handout, and then we'll be going through a demonstration. You will stand away from the sink. Your uniform should not touch the sink. That would contaminate it. You push your sleeves up your arms 4 to 5 inches, and as I said, remove your watch, which I put in my pocket, or slide it up your arm. You're going to use a clean paper towel to turn on the water. Adjust it to a warm temperature and then dispose of that paper towel in the waste container. You want to wet your hands and your wrists thoroughly, keeping your hands and fingers down. One of the things we all like to do when we're washing our hands is flick. We don't want to do any flicking. We want to keep it all down into that sink. We're going to apply soap to our hands and lather all the surfaces of the wrists, hands, and fingers, rubbing the hands together, washing all surfaces, and cleaning your fingernails by rubbing your fingernails against your palm of the opposite hand. Sometimes people have nail brushes. Other times you can have an orange stick available. But for basic purposes, that's how you do it. We lather for 20 to 30 seconds. Count off in your head. It is not enough to do it for 15 seconds anymore. We have too many superbugs that are resistant to some of that. And then you want to rinse all your surfaces. Hands, wrists, hands, and fingers. Fingers stay pointed down. Then you grab a paper towel and dry thoroughly with that clean towel. Dispose of that soiled towel in a waste container. Then you take another clean paper towel and turn off the faucet and dispose of that soiled towel in a waste container. Do not touch the sink at any time. The sink is considered dirty. If you're in a bathroom, a public restroom, and you're going to leave and have a door to open, see if you can push it open with your hip, or perhaps take another clean paper towel and get a hold of that door handle and pull it open and then catch it with your hip or shoulder and go through the door. There are a lot of germs on bathroom doors. So you may have that in your clinical experiences. You may be able to just wash your hands and not have to go through a door. I want to summarize by saying that this is the most important way that we as healthcare professionals can prevent the spread of infection. In our further learning, we'll talk about infection, cross-contamination, which we're preventing with the use of hand washing, and how to break the cycle in the chain of infection. Another thing to remember is that long fingernails have no place in the healthcare setting. You must have fingernails that barely go above the tip of your finger, and there should be no polish and no synthetic fingernails. Unfortunately, fingernails are an incredibly bad place for germs to grow. A number of premature babies in a NICU or a neonatal intensive care unit died several years ago because they became infected from the synthetic fingernails of the ICU nurses. Therefore, we aren't going to use any of that. This will be the first skill that you will master, and this will be the basis for all of what you learned as we go through this course. If you'll follow me to the sink now, I will walk you through an actual hand washing. I'm placing the waste container right here where I can get at it so that I'm not going to be turning too often. I'm taking a clean paper towel and I'm turning on the water. I want it to be warm, not hot, not cold. I'm putting my hands in while keeping my uniform away from the sink. I'm reaching up to get my soap. I have no watch on, and I have no long sleeves, so I need not worry about that. I'm lathering up, doing the palms, over the hands, up into the wrists, counting in my head to do the 20 seconds. I've done fingers, palms, top of my hand, and now I'm doing the fingernail cleaning by rubbing against the other palm. Keeping my hands low in the sink, fingers pointing down. I've lathered for about 30 seconds now and cleansed using friction and the antibacterial qualities of the soap. I'm going to rinse by keeping my hands down and in the sink but not touching the sink. Most of you probably want now to shut the water off or to wipe up. Do not. Remember, we're not flicking anymore. We're reaching for paper towel and we're drying. The water continues to run while we're drying. We dry thoroughly between each finger, over the palm, and then we throw it away. We take a clean paper towel because our hands are clean and we don't want to touch that dirty spot again, and turn off the water. Without touching that, we drop it into the waste can. This concludes our demonstration of hand washing for the healthcare professional. Thank you very much, and I look forward to our next class.